Hello and welcome to our presentation on the fastly evolving and developing area of technology that is 4D ultrasound imaging. My name is Somaia, and today my colleagues Fatmah, Mohammad and Hakim Wazir will today take you through some of the areas and aspects of 4D ultrasound imaging. But first, a quick look at one of the aspects of 4D ultrasound. In this example, a sample video of a fetus in the womb. Here you can see a 3D live video of the fetus, something which is not seen with a traditional 2D ultrasound. When most of us hear the word 4D, we wonder what it might be. After all, we are familiar with 3D and 2D. Simply put, 4D introduces a fourth dimension besides length, width, and height. Time is the fourth dimension which allows a subject to be viewed in real time. The same definition applies to 4D ultrasound. It allows us to view organs or a fetus in this example in 3D while it's moving and in real time. The mechanisms of acquiring a 4D ultrasound scan involves using a 2D array of transducers, which can have as high as almost 100 piezoelectric elements. Scans are acquired along a number of scan lines, which form a pyramidal web called a frustum. When the echoes are received by the receiver, an image processor acquires all the volume slices and renders them into the moving 3D object that is displayed on the top. Here is an image of the frustum that the object of interest to be imaged is placed within. Pyramidal scan format of 3D ultrasound imaging system showing 2D phased array transducer and the transmitting and receiving elements within the array. Transmitting directions are indicated by the dotted lines, whereas the receiving directions are indicated by dashes. Forty ultrasound has been a recent innovation and has a niche application, which is the imaging of fetus within the womb. This has been especially sought after by expecting parents that wish to view the unborn baby, and most natal clinics offer 4D ultrasound either as a diagnostic tool or as take-home memoirs of the unborn baby moving around. 4D ultrasound is also used in the diagnostic viewing of heart valves.
The advantages of 4D ultrasound. Number 1. It's a painless, non-invasive technique. All type of ultrasound involves a smooth, handheld device that transmits high-frequency sound waves through the body and gets picked up on the screen. The sound waves are high in pitch and intensity that cannot be heard by the human ear. Number 2. The technology is an upgrade version of the 3D scan. The extra dimension is time, and hence the fourth dimension allows for having to view moving images in real time. So in the case of a baby inside a mother's womb, you would be able to see a baby kick, open and close its eyes and mouth, and so forth. Number 3. Finding abnormalities that can be corrected if detected early. For example, both 3D and 4D ultrasound can help with diagnosis and assessment of the pelvic conditions that cannot be seen on the conventional 2D ultrasound. This including congenital uterine abnormalities where some women are born with the changes in the shape of the uterus. For example, bicornuate uterus, the location of the endometrial polyps, investigation of recurrent miscarriages, and preterm deliveries, just to name a few of uses of 4D ultrasound. Number 4. The sex of the baby can be determined during the second trimester between 18 to 22 weeks. Within this period, the fear of miscarriage has passed. The ultrasound would be able to show the health status of the placenta and the baby's body development, i.e., the spine, lips, fingers, toes, and the brain. The sonographer will be able to take note of the amount of amniotic fluid and will reassure the mother that everything is okay. Number 5. The mother does not need to be uncomfortable with full bladder before her consultation, although you may be asked to drink plenty of water 2 days prior to the scan as this has shown to result in better images, but you are not required to have a full bladder during the 4D scan. The disadvantages of 4D ultrasound. Number 1. It's expensive. 3D and 4D ultrasound can cost anywhere between $100 to $1,000 as not all facilities charge the same amount. Regular ultrasounds that are not associated with hospitals can cost around $100 to $300. The same procedure performed at a hospital can cost between $200 to $1,000. Often the cost can be reimbursed by Medicare and health insurance if the ultrasound was medically necessary, but if it is simply for pictures or determining the sex of a baby, then they will not cover the costs. Number 2. Ethical issues on how to price consultations. The examination costs taxpayers more than any other therapeutic and diagnostic procedures. In Australia, where the health service pays for 4 routine scans to continuously check up on the health of the baby inside the mother's womb. Last year, it has been estimated to cost up to $60 million in taxpayers' money. A $200 sonogram shot of the baby inside the mother's womb may be a good addition to the family's album, but is it really necessary, or is it really worth millions of dollars of the nation's health care program? Number 3. The decline of the mysteries involved with birth, so not knowing exactly what the child looks like. Number 4. And finally, 4D ultrasound is used strictly for viewing the baby inside a mother's womb in more detail. They are highly used for other medical purposes. I'll hand it down to Fatmah, who will be concluding and summing up the topic of 4D ultrasound.
So, in summary, 4D or four-dimensional scans build on the technology of 3D scans. The extra dimension is time, so the effectively 4D ultrasounds are moving images of the baby in real time. As the baby kicks, moves, frowns, grimaces, sucks their thumb, opens their eyes, and moves their lips. These movements can be seen on the scan as they are actually happening. 4D ultrasound enables visualization of more details of the dynamics of small anatomical structures and correcting abnormalities that might be found at early stages. Moreover, it is a non-invasive procedure that can be done in a short time, like it will take less than an hour. On the other hand, the technology associated with 4D ultrasounds make them more expensive, and they are not generally offered as part of a routine obstetric service. If parents choose to have a 4D ultrasound done, they will need to pay for this procedure themselves. And finally, ultrasound is barely used for medical diagnosis. Additional research is needed to determine the clinical utility of 4D ultrasound. For several purposes, like the diagnosis of congenital heart disease, central nervous system anomalies, and detection of fetal neurodevelopment impairment that is assessed by abnormal behavior in high-risk fetuses. Approximately 10% of all neonates are born with a birth defects, and moreover, 3% will have a serious, potentially life-threatening abnormalities. Therefore, 4D ultrasound scanning should be developed and be used more in medical diagnosis in order to raise the awareness and reduce these serious numbers. And that's it. Thank you for listening.